Now that we have looked at the client perspective, let's move our focus onto service providers. Adopting a telehealth delivery model is a big change for most organisations. We spoke to a number of service providers at varying levels of the journey, and they had some interesting insights. When telehealth is managed effectively, research suggests it has the potential to offer significant benefits to clients, clinicians, and service providers. These include more services to more people, greater reach for service delivery, more scope for groups with the ability to engage geographically diverse clients, potential to reduce wait lists for services if offered virtually, a reduction in failed to attend appointments, improved and real-time collaboration between service providers, improved continuity of care achieved through virtual facilitated referrals. Creating a successful telehealth service requires a rethink of a number of business areas: leadership, technology, and staff and client support. There are some core building blocks which can be established to make telehealth delivery successful. There are also a number of value adds service providers can include to optimise the experience of clients and staff. Let's look at the core requirements first. Leadership. For telehealth delivery to be successful, it must be embraced and modelled by the most senior levels of the organisation. This means the board, leadership and management team promotes the use of these services by investing in the infrastructure, training and support required to make it successful. Now the obvious one, technology. Does your organisation have the technology required to deliver quality care using this medium? This includes reliable internet connectivity that can support multiple video streams on top of regular usage. Secure video conference technology to ensure the privacy of both clients and staff. Staff support. One of the biggest barriers to uptake of telehealth for service providers was a lack of confidence from staff in using the technology and engaging with clients in this way. The more supported staff feel, the better the chance of a positive outcome. As a bare minimum, service providers should invest in training and support staff to become comfortable with the use of technology. Additionally, training on how to adapt support practices for the virtual environment will improve both the staff and client experience. Client support. Using technology for communications will be second nature to some clients, while for others it will be completely foreign. To help everyone feel comfortable, services should provide clear information on how to use the technology and guidance on what the client can expect in a telehealth session. It is also really important for clients to recognise this is as a professional service. While it may feel similar to a Zoom catch-up with a friend, there's certain etiquette and protocols that need to be adhered to. The service provider should make these clear prior to commencing a telehealth appointment. The value adds that can be added to further strengthen a telehealth delivery model include leadership. To embed the practice of telehealth, management should look for opportunities to model the use of technology for important internal communications, for example, staff meetings, staff reviews, and supervision. Technology. Providing a live support desk for clinician and client support through the startup period of using telehealth can be a great way to ensure a more positive experience for both clients and staff. Staff support. A staff portal and chat forum so staff can share their experiences and telehealth learnings, and a mentoring and buddy program for telehealth support. Client support. Building on some of the examples used in Mel and Rex's journeys, instructional videos are a great way to help people become familiar with online tools and systems. These videos could include how to use the technology, what to expect in a telehealth appointment, or a short introduction from the clinician. So that concludes our overview of how you can use the tools and resources developed in the 2019 Mental Health Access and Pathways project. Here's a summary of what I have covered. Personas and journey maps are useful human-centered design approaches that can be used to redesign service delivery models based on client experience. For the purposes of demonstrating how to use the tools, we use telehealth as an example of a service delivery model that could be introduced to improve client experience. We undertook a 6-stage process to do this. You can use and adapt this process to support your own organisation's client experience initiatives. The journeys for both Mel and Rex identified several service improvement opportunities where the use of telehealth may be used to alleviate some of their pain points and frustrations. Addressing these frustrations could lead Mel and Rex to have a more positive service experience and result in an overall improved communication and coordination and increased choice and control in their care. There are a number of considerations for service providers to consider if they choose to introduce telehealth as a model of service delivery. We have provided a few insights into what service providers should consider if they are wanting to optimise telehealth service delivery. We hope you have enjoyed watching these videos. I would like to take this opportunity to thank those individuals who participated in the sector interviews. Your time and input was greatly appreciated. Finally, please feel free to get in touch if you would like further information or support in developing your own client experience initiatives.